So I'm here because I've been working at a hospital since 1999, and I've been focused on web and web-related technologies. I am Director of Web and Communications Technologies for the University of Maryland Medical System. I've been responsible for our entire web program, content development, all the technology of the servers, video servers, etc. Also focused on web marketing. We were one of the first hospitals to use Google AdWords and those types of search engine tools. But in 2009, in addition to working at the hospital, I started focusing on social media, and I established this blog called Found in Cash, where I built a list of all the hospitals that are using social media. And there was a couple of reasons for that. I was there early enough in the beginning of the commercial web. I was actually doing web stuff, consulting with companies around 1994. I was there early enough to realize that hospitals usually are kind of far, one of the last adopters, far behind the curve, one of the last adopters of new technologies in terms of communications. And still remember talking to hospitals in the late 90s, and also 2000, 2001, saying you really should have a website. You should have a presence out there so people can find you and learn about your organization. And getting the pushback of, why in the world would we spend money to build a website? Everybody comes to us through the yellow pages. Okay. So 2008, 2009 comes along. I'm starting to realize that social media is going to be a fundamental shift in how people use the web and where they're going to be spending their time. And I would go to leaders in my hospital and at other hospitals and say, you really need to take Facebook seriously. This is going to be a very big thing. And they, of course, their response was, why in the world would we waste time on Facebook? Everybody goes to our website. So there we are. So I built a list to be a tool for folks that were in my situation, because nothing motivates the C-suite more than knowing that their competition is using a tool. And so this list, which started with about 140 or so hospitals, grew over the course of 5 years to something like 1,500 hospitals and links to about 6,000 social media sites, broken up by state so that anybody who was working in marketing or communications at a hospital could say, okay, well, here's my competition, here's the other hospitals in my state, and here's links to all their different social media platforms, and then get the buy-in to start doing social media. Because of that, I started, people started calling me about, how to do social media, and that kind of grew into sort of a second career of me doing some consulting and being at events like this. I'm definitely not a doctor, so that's why usually when I'm talking to groups of medical people, I want to very, very clear, I'm not a doctor. I don't play one on the web, but I do, like to focus on how we can use these tools. Here's the current realities of social media in hospitals. Most hospitals now have a token presence. They have a Facebook page, they have a Twitter account, but it's blocked at most hospitals. We just recently did a survey that was done by the Mayo Clinic Center for Social Media, and there's still a solid majority of organizations that will not allow their employees to have access to Facebook or other major social media platforms. It's still seen as yet another tool to push out information. Here's our latest news, here's a press release, here's an announcement of something. So it's really looked through the focus of marketing, reputation management, and those kind of tools, but not seen as something where we really want to talk to people and engage them. You have a question?
So you're saying the organizations block employees' use of it? Are they blocking their patients' use of it?
Yeah, it sometimes, depending on the network architecture, and that was a big issue at my hospital, we have guest Wi-Fi for our patients, but because of our network architecture, that guest Wi-Fi has to go through our same infrastructure. And so if it was blocked for a person working or sitting at their desk, it was also blocked for patients. And as I was working to get this changed, that was the #1 motivator to open up access, because we were getting enormous amounts of patient complaints, especially folks that we're a tertiary care center, so we have folks that are seriously ill, and are in the hospital for a very long time, with having very, very serious crises with their health. And here we are cutting them off of their support network. And so that was the number one motivator for us to change our policy and open things up. But that's all well and good, but we're still in that we're going to push out information phase. We're not really comfortable with, we want to actually encourage people to come back and talk to us so we can talk to them and have a true conversation. The perceptions that hospitals are seeing feel is that it's social media is a landmine, a field where anytime you go out there and you try to use it, you're going to be facing HIPAA violations, privacy issues. Big one is loss of message control. We are a type of industry that wants to be very controlling of what people think of us, very controlling, very top down. You have authority figures at the top saying, here's the messaging, everyone's got to be in line with that. And of course, the big one of employee productivity. Does everyone recognize Grumpy Cat? Okay. So this is the face I would usually see back in the day when we had to talk about, let's really use these tools, especially from my IT colleagues. That was definitely the face I saw all the time. What do you mean, Facebook? So that's where we are. But we did open up access. It took about a year, and we got access open, and it's been open now for 3 years. Absolutely no problems in 3 years of time, but a lot of very positive things coming out of it. Of course, I don't know if everyone can see this, but this is from a very well done study a year ago from PricewaterhouseCoopers, where they were looking at what is the public perception of hospitals and healthcare professionals using social media. And a very, very good study, and I've just pulled one slide from this. And when they talk to consumers, patients, about who are you going to trust when you see information in social media, doctors were trusted more than any other institution. They said we are likely to trust information that came from our doctors 61% of the time, followed by if a hospital puts that information out, we would trust it. Falls off rapidly if it was a health insurance company putting out information, and very unlikely to trust it if it was a drug company putting out the information. Now the ironic thing, and this kind of the sad thing, is that here are the consumers, the patients, saying, we are ready to listen and follow what our doctors are saying in the social media space, but they're not doing it. And so there's a real opportunity for us for physicians and other healthcare providers to really use these tools. But I do want to say, I learned from the presenter last night. I started with the negative, and now I'm going to say but, and now we're going to go into the concept. But there is, I'm starting to see some very positive things happen, and we started this about 2.5 years ago, right after we opened up access. We had several different nurse practitioners and other support people come to us and say, I run a support group, a real life face-to-face support group for a particular segment of people. And we'd like to put up a Facebook page. And after some work through that, we worked with our legal department, we worked with the people that wanted to run these Facebook pages and set up the rules. We started setting up these groups, and they've been very successful. They're managed by the same person who was traditionally managing the face-to-face groups. We're using Facebook groups, secret and closed groups, so that you have to be allowed in, and the information you put out there is not public. And then it's sanctioned by my department of the communications department. So we monitor it, and we help and we advise the people running the groups. We have 4 groups now. I think actually there's probably 1 or 2 more now. Liver transplant patients, people that have Hep C, people with very serious digestive diseases like Crohn's or IBD, and of course trauma survivors. Between 50 and 100 members each, and again started in 2011. I'm going to focus on one. This is the patient support group for the liver transplant patients. Probably can't see that, so let me just read it. Janet Gripshover is the nurse practitioner who is the admin of the group, and I think there's 110, 120 people in this particular group. Here's an example of a post that she made. Reminder for all post-transplant patients, when you get immunized for the flu this year, make sure you get the shot, not the nasal spray. And then that message went out to everybody in the group, and a lot of them responded, I've already got my shot, and there was a kind of good feedback on that. Here's another one that was put, and I've taken out identifiable information. One of the transplant patients said, has anyone ever met their donor's family? What's your take on meeting them? And dozens of people in the group responded. One person said, I had the privilege of meeting my donor surviving sister. We started writing, emailing, and texting, and we finally met in person next year. And they started sharing basically a question that would only apply to people in this group, this small group of people who have received a donor organ. Here's a question that they could put out there and get very good targeted responses on. Another very poignant message, I'm so thankful for the support group. You have all made my wait for transplant bearable. There is so much love here. Only we know what we're going through. Now, none of this is remarkable in terms of patient support groups. Patient support groups have been around for many, many years. But what is remarkable is that this is one that is moderated and sanctioned by our hospital. And I don't have a slide for this, but a couple of weeks ago, there was some story in the New York Times or one of the major publications talking about how people who have had an organ transplant should be careful about owning a cat as a pet because there's some danger of getting toxoplasmosis. So one of the members of the group posted that. People started joking about their pet cat trying to kill them. And then that went back and forth for a couple of hours. And then Janet Gripshover, the nurse practitioner, stepped into the group and said, okay, here's what the real facts are about this. It's extremely rare for any of our transplant patients to get toxoplasmosis. In fact, it's so rare we don't even test for it. Here's the things that you should do if you're concerned about this, but bottom line, that's not something for you to really worry about. That message got communicated to 100 plus liver transplant patients in a matter of hours. Something that they had all sort of seen and heard and was sort of in the back of their mind as a concern had been answered, had been solved, and then they can move on to other things. So that's a really good example of what this can do if you have healthcare professionals getting involved. And that's it. So I hope that tees up what the challenges are and what the opportunity is. And yeah, you have a question?
And I have a quick question about physicians. So we know consumer demand's high. They want to hear from doctors on social media, but I imagine there are some pretty significant legal risks for a physician who shares advice or knowledge on a Twitter feed or on Facebook. How are you addressing that, or how can you help docs address that?
Yeah, very good question. If you're ever in a conference where a lawyer is standing up and telling you you will be scared to death.
Yes.
You will turn off your computer, you will throw out your smartphone, and you'll never get anywhere near technology. But I use the analogy of the radio talk show. First of all, let me just say, we've had an Ask the Expert tool on our public website now for 10 years. We process 15,000 questions a year that are answered by 100 doctors on a whole wide variety of medical topics. And when we set that up, our instructions to physicians were, pretend you're on a radio call-in show. You're being interviewed about the latest techniques for managing heart disease. And somebody calls up and says, I've just been diagnosed with XYZ. What do you say? Well, what you say is, here's what we know about XYZ. Here's the standard of care for that. Here's what is on the horizon. You should talk to your doctor to find out what's right for you. The whole point, the whole approach is you use these tools for education. Now, to me, the amusing thing is that those 15,000 questions that are coming through, the doctors are saying the exact same thing that's already on our website. It's right there next to what you ask the doctor. But it's coming from a doctor, the person who asked it gets an email, and you get a lot of satisfaction out of that. So if you follow those very common sense rules, there really is no issue. Don't prescribe, don't diagnose. Yes?
So since we're at a conference where we're focused on outcomes and quality,
Right.
have you looked at outcomes and quality associated with the patient support groups on Facebook, and how do you approach that? Do you look at, for example, the actual content of what's being said, or do you look at the association with visits or any specific kind of outcomes?
No, we haven't done any of that. And that's obviously an area that we need to move into. And I think that it's sort of a chicken and egg problem. It's not for me as somebody who's a web guy to be running that study. That has to be something that's done by our medical researchers. And until they're comfortable that this is actually a legitimate thing to do, we're not going to get that kind of data.